Hello there, it's Michael Wilkinson here. Is Peplo on the call? Okay, what I think I'll do is I will start with my presentation then. Thank you very much. I'm going to present a technology that we've developed called Avatr, which has a focus on health in the cities. My name is Michael Wilkinson. I'm the CEO and founder of Anavia, based in London. And I'm going to talk through the development of the company and the benefits that we're seeking to provide people in the cities, and also our business plan going forward. The company started in February 2015. That's when it was established. And we have three core values that continue to persist after these 5 years, and that's transparency, inclusiveness, and empowerment. And the story that we have started before February 2015. I've been working in public health for about 25 years in health informatics in places such as the London School of Hygiene and the National Health Service in the UK. And what I realized over that period of time was that there were many people with chronic diseases, of course, but some people with chronic disease seem to survive and thrive, or at least manage their conditions better than others. And that interested me quite a bit. And over the years, with the development of artificial intelligence and machine learning and computing and mobile telephones and so on, I started to think, is it possible that we could create a technology that could enable an individual person to start to get more control of their lives and to deal with the challenges that confront them? To have effectively an AI companion to help them guide through the challenges and struggles, to have the type of resilience that other people sometimes have so that they can cope better with their disease. Effectively, to develop a technology which enables, engages, and empowers the user, where the user owns and controls all their own data. They create their own digital profile of themselves, such as a digital twin. And they can choose to share that with a healthcare provider or others to get better services in return. And we don't sell the data, we don't commercialize the data. We're only interested in the quality of life and the quality of interaction, primarily between a doctor and a patient, to improve that quality of interaction. This is essentially Avatr. And we started building the technology as a team of scientists. There's 5 PhD scientists in computing and mathematics and philosophy, and we have 2 designers. We started building the Avatr technology with a research grant from the UK government to create the so-called quantified self. And this was a part of our research proposal to create an ontology-based contextualized user profile, which the individual user owns and controls themselves. Which once the user creates that profile, they can then match their needs and aspirations with products and services that are available to them in the local context. Effectively, to have a user-controlled user journey, which delivers very personalized and contextualized services. So this was a research bid that we put forward in 2015. We were awarded that, and we were awarded 8 others following. And essentially what our technology does is it focuses on the quality of the doctor and patient relationship, helping the doctors make better and informed decisions, and for the patient to be engaged as partners in their healthcare when they're outside of hospital. And we focus in particular on the ability of a doctor to craft very personalized prescriptions based on the data that they receive from the Avatr system, and to be able to predict when the patient may go into a health decline, and so the doctor can intervene via the Avatr so that the patient can avert a potential health problem and to stay healthy. So effectively, the Avatr system has artificial intelligence and machine learning, where the doctor with the patient can set a prescription, engaging the patient in their own care to deliver highly personalized health care. And the prescription includes what you would expect, the diagnosis, medications, diet, exercise. The patient will be asked sometimes to take readings such as blood pressure readings. And the Avatr assists with the management of all this. Effectively, when the doctor sets the prescription using the online system, they're setting algorithms which drive the interaction to the patient, which I'll show in a bit. But in addition to that, we've been developing the predictive capability. So we know how the patient is performing against their care plan in time and place at any moment. And also, if they start to go into a health decline, we can predict that decline. And also aggregating that information at population level to support public health and population-based healthcare. So this is the whole Avatr system, and the types of data that we collect is behavioral, environmental, sensor data, data the patient inputs through text or voice, and so on. It's all harvested by the Avatr system. It's rendered against a theoretical construct that we've created for the Avatr machine, and that helps the patient and the doctor to keep that patient safe and well. The system looks like this, where the doctor has a dashboard. On the right-hand side, you'll see the on a mobile phone, but also they can have it on a desktop, laptop, and so on, and they can get live actionable decisions to inform any adjustments that the doctor needs to make to the care plan. And for the patient, the interaction with their own avatar, it's unique for them, is done through a chatbot, which they can text and respond against, or also speak to as a voice interaction. We've been working in a number of cities and hospitals globally. We have a list of some of those hospitals here, spanning Asia, with in Singapore with the National Heart Center, in Germany with the University of Frankfurt Hospital. We're doing a project with Bart's Hospital, for example, in London, St. Bartholomew's, and also Leeds Teaching Hospital. And in Brazil, we've been developing a Newton Fund project over the past 2.5 years, working primarily with INCOR Hospital, which is a part of the University of Sao Paulo system and the largest hospital network in Latin America. And what we found doing this work is, as we developed the Avatr systems for each of these hospitals, the doctors in the hospitals want to communicate and collaborate with each other. So we've now started to develop collaborative opportunities, such as webinars, and I will share that with you later in this presentation. What we've been doing with the doctors in the hospitals is testing the Avatr system with these levels of patient numbers to be able to define and measure the benefits to the patients in terms of patient engagement, health improvements, and also to the hospitals in terms of clinical improvements and cost savings. This is an example of the type of outreach that we do. We have regular webinars bringing together people internationally. And this particular event that's coming up at the end of this month, I'm speaking about a project that we have called Project Citizen, which is a project funded by the UK government, a Newton Fund project. And as I mentioned, we're working with INCOR Hospital. Guillaume is going to be presenting. He's the head of innovation at INCOR. We've been working with him and his clinical team to develop Avatr opportunities to support patients in the hypertension unit. And that collaboration has been very successful. And by the way, the Avatr system is able to be used in many languages, including Portuguese in Brazil. And the other speaker is Jonathan Wong from the United Nations. He leads on technology and innovation. And because the Newton Fund project is looking at sustainable development goals, Jonathan is very much involved in these goals and managing these goals. So he will also be speaking at this event. which is scheduled, as you see, on the 30th of July at different times around the world. And it's a free participation. We encourage anybody who's watching this to join us. But the Avatr system is really designed as a public health service, in the sense that we're looking at developing services and technologies that enable a person to live well outside the hospital on their own terms. It allows a patient, as I said, to create a digital profile of themselves, which they can share with others, including doctors, so that they can get improved healthcare services and to stay outside of hospital, to have control of their lives. And we've been working, as I said before, in places like Singapore, which has an extensive smart cities network, as does London. And what we're interested in is how a person can comply with their healthcare plan, engage with their healthcare plan, but also engage with the city where they live, where the city is positioned as an enabler for public health, where it supports and encourages public health, where there's a partnership between the supply side, such as pharmacies and grocery stores and restaurants and employers, and the demand side, which in this case is the individual citizen in the city. And so as we go forward, we're going to continue to develop this connecting of the individual citizen in the city and making opportunities to improve service delivery on the supply side by delivering what patients actually need when they need those services or products. This is the team that we have at Navia. It's myself as the lead, and my other co-founder is Aleardo Furlani from Italy. He has established the Innova Lab based in Rome, which has been running for 30 years successfully, and with offices across Europe and the US. Amrik Tulen is another director on the company with an investment background, and he leads on our financial relations. The scientists are all covered in blue. There's myself. I've come from a public health informatics background. Alessio is a technologist in artificial intelligence, as is Marco. They both have PhDs in this area. Peter Jaspel Sahota comes from a philosophy mathematics background, and he's developed a lot of the algorithms that we have. And Fabio works in technology transfer. And we have two designers, John Walters and Chris DaCosta, and these designers actually come from the film industry. They weren't web designers or web app developers when we met them and when they engaged 4 years ago. And the reason for that is because the user experience is almost cinematic in terms of how a patient interacts with their own avatar, how they create their own journey, and how they connect with the city. And so the experience that the avatar provides is actually quite unique. That's it from my presentation. I just wanted to give an overview of the avatar system, the work that we're doing in Brazil, mentioned Singapore and London, and introduce my team. We're always interested in collaboration with partners who are interested in promoting health in the city. So if you have that interest, my details are here, and you can also contact me via this campus system. Thank you very much. I'll now go back to the screen.